Hey, it's Laura Boozer with Fascia Pro. I wanted to hop on and do a quick tutorial for how to modify and hydrate the pec tissue. This is a very complex area. After I show this tutorial, hang on for the last couple minutes and I'll give you a deeper anatomy lesson on it. But let's get right into the move. So you have a nice little natural indention into the pec tissue, and our intention is to put this roller right in that indention. The setup is the most important part, and we're going to use the wall. So make sure you have a blank space that you can lean against the wall with your roller. And you'll feel this indention again, and I want the side I'm working on for the roller to go low. Now, setup, people do all kinds of interesting stuff. They want to put their arm above it and below it. Our intention again is a pec minor tissue, and we're trying to get hydration right in this complex. So angle it, outside down, inside is up. Find yourself space on the wall. Now I'll invite you to stand against the wall. Let me get where you can see. And then take a step back, because we're going to use our body weight and go into a lunge. Keep your roller at the angle and lean into the wall. We're flying. So if you don't start in the lunge and lean, you're not going to have anywhere to go. Okay, so simple move. I like to put my hands on the wall like Spider-Man. I could almost pick the weight up in the front of the foot. It's all being done back here. And I'm going to push up into the roller and back down. We're gliding. The roller's moving. We're only going a couple of inches. You can roll, turn towards the wall a little bit. There's quite a bit of space through the pec area, and find your sweet spot. And the secret to these glides again are pushing up into the curve of the roller and back down, but don't let off your pressure. Keep the pressure consistent and the same, except, what's the one rule? Don't cause pain. Awareness, a mild discomfort maybe, but we don't cause pain. And then after 3 to 5 glides, we're going to then pin the tissue. I'm simply leaning. This is effortless. Pin the skin and shear back and forth. So again, I'm pinning the skin and the tissue's moving back and forth like this, right? Then I can go up into the roller and back down again, up into the roller and back down again. I'll pretend I'm on the wall. Up into the roller and back down again, and then the shears. So you actually see the skin moving. You can see the strap in the swimsuit moving back and forth, and then compress and wait. Now you know how to work this area. For those of you that want to understand what's happening in it, let's talk anatomy for just a moment. So this complex of the shoulder, a lot of things happening in this area. It's a ball and socket joint, much like the hip. So these two areas, there's a lot of neurology, vascularity, lymph nodes, just a big congestion area that a lot of things can work, and why this move, the pec move, is so important to do. So pecs, you've got pec major. It's the big guy that's running basically from the sternum and this whole corner, this diamond shape, out here onto the bone of the humerus. So when that guy is tight, it simply medially rotates or interiorly rotates, rounds your arm around like this. That doesn't necessarily pull you down. That's the pec minor, which this move is so effective for. The pec minor is this little guy that attaches to 3rd, 4th, 5th ribs, and then it runs up, and there's this little bony prominence that we call our coracoid process. It's actually part of your scapula or your shoulder blade. So if you're thinking of your shoulder blade looking like this, it's this little bony piece that comes through. And my pec minor that's down here on the ribs is coming straight up and attaching to that in here. So it's like this little gap, if you want to call it that, underneath where my nerves, my brachial plexus, ever heard of Thoracic Outlet? When they diagnose you with that, that's commonly known to be carpal tunnel. All of those challenges are happening up here. So if we stay in this modified position of being protracted and that pec minor is pulling me down, then wouldn't it be true that that little bundle of nerves, radial, median, ulnar nerve, bound together right here, is being strangled? It's not. It's the fascial layers that are adhering, and it's not allowing it to move. So you can stretch it all day long, but in a lot of situations, you might actually be irritating it. So let's hydrate it. Let's shear. Do that little move and tell me what you notice. leave it in the comments. If you have any questions about this area, please leave that in the comments as well. I'd love to hear the changes that's going to make in your daily journey. Maybe get rid of those numb hands and fingers and stop you from having to have another surgery or your first one. We don't want that. So hydrate your fascia. Have a beautiful day. See you on my next video. Make sure you like, subscribe, and share my channel so that I can continue to bring you more free, complimentary ways to live a pain-free life. Be blessed. Have a beautiful day.